Okay, so now it's really a pleasure to introduce Dr. Sharon Sansimone, who is at Columbia University, but that we've had the fortune of knowing each other for years since we were invited down to, or I was invited down to Sao Paulo. And, so I just hope we can extend a round of applause because Sharon just learned, actually her K99 ROO just started. So maybe a quick round of applause for Sharon. And those not familiar with that paradigm or that grant funding mechanism, the K99 is a career award that provides 2 years of funding for training. And then the ROO is an early independent stage investigator award. So it's nice 5-year funding award that couldn't be more happy for you, Sharon. So with that, I'll have you come on up. So Stephen, is this good to go? Okay, great. Just looks weird.
Okay. All right. Thank you so much, Professor Hampstead, for organizing this amazing event, for everybody that is collaborating. It's amazing symposium, and I'm very honored to be here with very inspiring colleagues that have inspired my research questions in my career so far. So pay attention to what you pay attention to. I hope this title help you to pay attention to what you pay attention to in this talk too. Training attentional control in cognitively healthy older adults. So this is my new project that is related to my K99 that Ben just mentioned. Okay, so I just want to put in context cognition-oriented treatments in the context of reserve resilience framework. And thinking, well, there's a lot of effort to define the terms reserve resilience, brain maintenance. I'm not going crazy with these terms, but I just want to summarize cognitive reserve as a property of the brain that allows for sustained cognitive performance in the face of age-related changes and brain insult or disease. And think that codes may induce processes that protect individuals from the effects of aging or brain diseases, possibly by increasing reserve resilience later in life, and enhance performance or maintain performance over time. It's still a question and both valid, as Ben mentioned before in the morning. And here, when you look at this model, I think it's very informative to think how age influence is related to brain structure and function, and make it potentially pathology that may exist or not, mediate or moderate this relationship. And the interventions will be right there when we, in this green arrow, when taking consideration the background of each individual, what we can call a cognitive reserve related to life exposure, lifestyle, opportunities through life, individual differences, and how all these parts of this model is also influenced by individual differences. And I think it's important to highlight that these interventions may really be critical to modulate the clinical presentation. So we have cognition, behavior, function. So I like this model to think also that cognition-oriented treatments can help us inform and better understand mechanisms of reserve resilience as well. It's a good model to investigate these ideas because we are intervening, exactly. Okay, so the way I'm defining here, training, cognitive training is repeated practice on standardized exercise or strategies, target specific cognitive processes, and optimize cognitive functioning or compensate deficits. And earlier today, it has been mentioned process-based, strategy-based approaches. And I think they are not necessarily opposed or excluded. And I think in this project, although it's more strategy-based, we are also using process-based approach to reinforce the strategy to make it more sort of, I don't say the word automatic, but more incorporated and more natural. You can call people really use this more naturally. And I think the other piece that is important to think cognition-oriented treatments and in our projects is technology. The challenge and the interesting part of it, it's more visually appealing, enjoyable, can be ecological, realistic. We can simulate real life demands, adapt training, content, and difficulty. And after pandemic era, in the pandemic era, we can think about remote and accessible, scalable aspects of intervention, but also we have to be careful with technology literacy, access to technology, and level of supervision, or how we have control of the environment when we are providing interventions online, digital. And so attention executive control has been used as interchangeable terms. I would here put as a attention/executive control. It's a relevant training target because it refers to control processes that enables the execution of complex goal-oriented behavior under demanding conditions, involves monitor, coordinate complex behaviors, planning, reasoning, selection, and inhibition of appropriate actions. It's not a unitary construct. It involves resistance to interference, inhibition, coordinated ability, task shifting, working memory, and we challenge this control process when attempting to simultaneously accomplish multiple goals, what we can call multitasking, and which involve dividing attention between multiple skills, tasks, cognitive sets. And we know already that it declines with aging and is a frequent complaint, has clinical relevance, dividing attention, learning new things in a demanding environment, and maybe associated functionality. So I just want to highlight this work from Gazili's lab. It was published a few years ago, a Nature journal, and showing that dual tasking and multitasking decline across lifespan. As you can see in the graph, from 20s to 70s years old, declining. They use a video game simulated driving skills here, and they perform a training using this tool, showing that comparison to no contact control and single task training, multitasking training showed to be more beneficial, which is a very important piece, that dual tasking training, and sometimes called multitasking training, may have additional benefit than single tasking training, which was already interesting, more beneficial than no contact group. And when you look at the dual task training literature, as Professor Belleville mentioned before, there is literature, previous work showing that variable priority training may have additional benefits that fixed priority training. And this has been even associated with specific regions, superior middle frontal gyros associated with multitasking tasks. And although this literature is promising, as other areas on cognition-oriented treatments, we see consistent near transfer effects, but inconsistent far transfer and maintenance of the effects. And related to this literature, another way to think about dual tasking training and variable priority training is what we call emphasis change, what I'm calling pay attention to what you're paying attention to, which is a strategy to change systematically the emphasis or attention allocation on different components of a task through a set of instructions and feedback. So this is important because it's not about guiding how or when or which aspect are you going to put more emphasis, but giving a feedback about what was the effect of doing this. So these two components are very important, this approach. So this approach has been, it may facilitate and enhance exploration, exploration in general, encourage individuals to explore alternative ways to do the same task. And here is not just providing, breaking down different pieces, something that is complex, but it's to learn a complex task, maintaining the whole task intact. So it's more realistic. So you learn something that is complex, putting emphasis in different aspects of it, but maintaining the complexity, which it simulates more real life when we cannot really breaking down in parts. We have to deal with what's going on and try to perform the best we can, depending on the demands we have. And there's a component of metacognition here, as Professor Belleville mentioned, So the management of competing task priority to self-regulation. So I think here we can think about the awareness piece to how we are really aware of where we are putting our attention, our effort in a task. Okay, so this start to be applied in a military context in Israel by Professor Daniel Golfer, which is one of the collaborators of our project here. And he developed a video game called Space Fortress. And he could see 10 hours of training under emphasis change increase 30% of flight performance in young pilots. And he has been doing a lot of this type of training with young adults, and also relate to sports world and applying, developing tasks and games for basketball and hockey players. And there's even a recent study that used the game called IntelliGym, that is currently used in hockey college, US college league, that and it uses a lot of emphasis change, that there is association to using this type of video game for the players to reduce head impact. So here the idea again is having the situation of the game, complex, the tactics, etc., and putting emphasis in different aspects of the training of the game. And also few years ago, almost a decade ago, actually, this was translated to aging research in collaboration with my mentor, Jakob Stern, Columbia University. So Professor Golfer, Professor Stern collaborate and use this very same video game that he developed in the 90s for the pilots to older adults, healthy older adults. And this was a pilot randomized control trial to look feasibility, efficacy of Space Fortress using emphasis change. So it was an intense program, 36 one-hour sessions, 2 times a week over 3 months, and they compare people 6-month intervals, and they randomized participants in the experimental group, which was with playing the game with emphasis change, the active control, which was playing the game without this standard instructions, so it's sort of a regular game, and a passive no control, no intervention group. And they found good adherence in transfer to letter number sequences, and different results showing emphasis change group with higher benefits, greater benefits than the active control group. But there was a lot of challenges, lack of transfer to other traditional neuropsych tests, motor interference because there was a joystick in this video game. And this was a game that was not really related to everyday life. It was a game developed for more a war environment. But despite that, actually, the participants enjoy a lot the game, and it even being like intense and a hard game, but there's a lot of this report that was challenging, and so putting these pieces together, the idea that executive attention control training, it's a relevant target, emphasis change is a interesting approach to be further explored, and has some preliminary data, but still more that can be explored with this approach. And the need for more ecological tasks, intervention, and adding the piece of technology, telehealth, how we can combine these pieces in design and study. So this is how I start developing the breakfast game in collaboration with Daniel Golfer and Jakob Stern and many others. And the idea is to develop a web-based platform for training and also test emphasis change using this platform. And this is my K99 now. So what is the breakfast task with the original name that was developed by a Canadian group, Greg and Bell, Stock, 15 years ago, even more. To evaluate the effects of aging on complex planning, multitasking, executive control, simulates executive requirements involving cooking a breakfast, which is everyday life activity. So this is how it looks, the original version that has been associated with different executive tasks involving planning, working memory, task switching, has been considered a valid measure, fast, enjoyable, lifelike assessment. Young adults has been shown better performance than older adults in this test, bilinguals, better performance than monolinguals, and it differentiates persons that control subjects in research. And the idea here is to transform the same idea, this paradigm, in a training version that not for assessment purposes, but a platform that we can modulate different aspects of this task, which is a complex task already. And what is this about? So we have here, let me see, is this, okay. We have the table setting task, which involves voluntary investment, we call. Basically, the idea is to set the tables for these 4 guests. So you put the tableware, and you can have different rules for this, like by guest, then you put like table and utensils, then you move for the other one and the other one and the other one, or by tableware. So put all the forks, all the knives, etc. And here, the task, you get a score 1 point when you complete the 4 people here in the table. So you can have more control here of your timing, and the faster, the better in terms of more scores. And we have the cooking task, which is more difficult, and it's what we consider imposed load. So you have a lot of constraints of the timing that you need to cook certain items. So like the coffee lasts 4 minutes and a half, the bread, the toast, 1 minute. So you have certain things that you have to follow. And the idea here is to cook the food item in its accurate time and finish all them together. So the cooking task itself, it's a dual task because you have to coordinate all this. So the idea, you press the start button to start cooking. And so the bars start go down, the time start to be counted. And when you press the start button, it became a stop button. So you have to stop when it's the right time. So if you don't stop in the right time, you overcook. Or if you stop early, you undercook. And you lost your scores also suffer because of the timing issue. So, and there are the 3 game outcomes here, which is number of correct tables and range of stop times, which is the synchrony of finishing the foods together, and discrepancy, which is accuracy in cooking food. So this is the game outcomes, and we in the platform we can manage the number of food items, or we can even have this task in same screen or different screen. So you simulate, you impose more working memory load because you have to track what's going on in different screens. So you have to memorize and more what's going on, or just put more effort in your working memory. And you can have different rules for table setting. And so some examples here, what is the game instruction? So press start for making the coffee, which is always the longer item in terms of time, and set the tables for guests. And the emphasis change instruction example, we repeat this, we just add this sentence after, please pay special attention and on the cooking task, 75% of your scores will be based on it. So this is how we introduce emphasis change in the different trials. And this very first study that Gopher developed with young students in Israel, he could show some benefits of emphasis change using this platform in a small sample and trying to really show the potential benefit of it. And where we are here with this project, so there is this first study launching the platform. We call phase 1, 2, and 3, but the idea here is that this first work we did, preliminary data for MyK, we transformed this platform to be web-based. So we look to feasibility only, not with effects of intervention or something like that. It's just feasibility. And what happened was when we really started this study was like early 2020, so in person. So we, of course, interrupted and we decided to really go digital and embrace the situation as an opportunity to develop the platform online, to be online. And then we have some preliminary data I'm going to show very soon. And now I'm recruiting participants for this pilot study, which we are developing a 13-session protocol and really going to look to effects of the training, and a phase 3 intervention or trial that we will optimize the approach based on the pilot data, where we add AD plasma biomarkers, and we want to look to maintenance of the effects and potentially moderators of intervention response. Of course, we have a bit more power, but it's always an issue of power with moderators, but this is the plan so far. So I'm going to talk about these two and the phase 3, hopefully in a few years. So the idea of this feasibility study was assess recruitment, adherence, retention. By the way, if you're interested, we have a preprint if you want to look more carefully at the study. The goal was to examine accessibility of the web platform, access the difficulty or clarity of the instruction and tasks, assess the responsiveness to emphasis change instruction, evaluate usability, acceptability. So it was a single-arm digital intervention that we ran during the pandemic with cognitively unimpaired adults from 60 to 75 years old, English speaking in US. So we did a phone screening, online screening, all through Zoom, and we asked them to participate in 5 sessions twice a week, and then we did the acceptability questionnaire. So it's a feasibility, right, simple study that we are not again looking to effects of training yet. And so we recruited during the pandemic, was interesting experience. And we understand the recruitment rate when we look to participant contacted, we're close to 40%, but when we compare to those that consented to participate, was pretty high. And then we have 24 participants, and mean age 69, most females, highly educated, mostly white participants, and as I said, cognitively normal individuals. And the idea here was that we increase the difficulty of the training slowly. So the first 2 sessions, there is no emphasis change. We just wanted to see how they received the game, how difficult it was. So we start with 2 or 3 items. So it was not 5 items right here, like here. We introduced different rules in the table setting and on the same screen as is here. We have a good time to set the instructions, to practice before the session. And then we have a second session that was not supervised. And we wanted to see how it was for them to access the platform alone at home. And then they have a new challenge that was different screens, as you can see here. So you couldn't see both tasks at the same time. So if you switch too much between them, you lose time in your performance, right? So the better you can keep track of what's going on in each side, the better you can perform. And then the session 3, 4, 5, then we introduced emphasis change. The session 3 was supervised, 4, 4, 5, it was not supervised. So we asked them to emphasize the cooking task in the session here, to emphasize table setting. And the session 5 was more variable priority approach because depending on the trial, they had to emphasize different aspects of it. So for those that started trial, all of them finished 100% of adherence. The average days between sessions was 3 days. Most of them could really adhere to what we asked to keep between 1 to 4 days. They were able to access the game platform without supervision. And again, I'm very careful here to talk about improvements. There's not about effect of training yet. It's about what we observe more qualitatively here. We saw this pattern of the better performance was in the last session for all the 3 game outcomes. So remember, here is time-based, so lower score, better score. And here's a number of correct tables, so more tables means better performance. So we could really see that when we introduced like the split mode, which was second session, we separated 2 tasks in 2 screens, the performance was a bit worse, and which was the same for the 3 measures. And when we start to introduce the emphasis change, the performance was better at least in correcting the tables, this was even more clear, depending on the emphasis change approach, and the better performance was in the last session. Doesn't mean that emphasis change is working. This is, in my opinion, about learning the task, about practice the game, but at least we could see they can learn the game, they can play the game. And we run an exploratory analysis to see by emphasis change trials if we could see some encouraging data, and we could see clearly that the more emphasis on table, better the performance, but we didn't see this for the other outcomes. And this was interesting because this suggests to us what we already was thinking about, that the cooking task is already a dual task, and we improve this for the next trial, that we are actually being more specific about emphasis changing, finishing the food together on an accurate time. So we are adding another set of emphasis change within cooking task only too. Okay, and here, just the acceptability questionnaire, I'll be very quick here. The idea is that there was overall good acceptability, but there was challenges. There were technical issues with the platform to drag, drop utensils, size of stimulus, some repetitiveness. So we are learning a lot from this trial, but I think the idea, the taking home message for this first study is that it's feasible in older adults. And this 13-session protocol is in breakfast study. It says the idea is, again, to evaluate acceptability, usability, and the structure of 13 sessions, then in cognitively healthy older adults, and examine the effects of emphasis change. So it means training games and transfer effects. So the overall design, we would randomize 40 participants to one group that will play the game with emphasis change, and the other a regular way, which could be guided with this strategy. And then we are looking to cognition and behavior change to transfer effects game performance. So here it's 13 sessions, it's 5-minute session, but we are considering here a lot thinking about what Professor Hampson said before, trial-based also. So it's 8 trials per session and 3 times a week. And 5 of these 13 sessions will be supervised. So every time we introduce something new, we want to see how they receive this, but also in the same time, we want to understand how they access and the platform alone. Here is just the idea of the protocol. So it's interesting because we are here going to have a first practice session, because we will build the difficulty of the task. It's a complex task, slowly here. We don't want to expose them too much to training before the real training session, but we want to make sure they can play the game. And then we have the session 2 and session 13, exactly the same, exact same session, that they will not receive any emphasis change instruction. And we are going to contrast this performance between these 2 sessions and look training gains in the platform. And during session 3 to 12, 10 sessions, one group will play with the game with emphasis change and the other regular game. And then we are going to look, as I mentioned before, the game outcomes. So contrasting session 2 and 13, and also exploring other ways between trials and sessions to look to this game performance. And we are going to consider here transfer effect, a proximal measure that is related to attention priorities. That is the alphanumeric test that Professor Bellevue mentioned before. We recently developed a web-based version of this task. And as distant measure, which is also transfer effect, for some reason it's not going. Well, okay, it's right there. We are going to look and explore other ideas. We can consider a secondary measure. So executive functions, composite score using more traditional neuropsych tests, but also using a very sensitive, the useful field of view task, using active trial that has been shown very sensitive to divide attention training. And it's related to driving skills, and is related to risk of fall in older adults. It's an important measure. But also we are going to look to learning episodic memory, which it's kind of very exploratory. I don't expect to see much of change, to be honest, in learning here. It's more like executive attention components, but also self-efficacy. mood, and complex activities of daily living, which basically is questionnaires about cognitive failure, difficulties in everyday life, and cognitive leisure activity engagement in everyday life. And we want to understand if this may have a change after the protocol. And last, we are going to again, look at usability, acceptability questionnaire, and the perception of participants of this for the study. So to conclude, the idea here is that attention and executive control is a relevant target, emphasis change, is as a modality of variable priority training type is a powerful approach that can be further explored. And the web-based breakfast game seems to be feasible in older adults, and we are ready to move to the next phase here. And it's a preliminary data, it's a work in progress, and I hope to soon have more data on this work. And I'd just like to thank many people that have been on board in this project with me, especially my mentor, Jakob Stern, the K99 advisors and collaborators like Dr. Belleville, Dr. Hampstead, and all the support I have been having, and a lot like Professor Daniel Goldfert that idealized a lot this project, and all his support from Technion Institute of Technology in Israel, and of course a funding source, NIH, for funding this project. And if you stop by New York, please say hi. Thank you.
Questions? Here, I'll grab that. Good hustle.
Thank you. This is really interesting. And one of the things I've been thinking about is flashback to 2016 when luminosity was really big. You got in a lot of trouble for false advertising, and it just seemed like the breakfast game reminds me a lot of like the restaurant game that was in luminosity. And so, can you talk about like what are some of the differences, or what were the, because was it mostly advertising that was the issue there, and less about actual outcomes?
Okay, thank you. Yeah, I think it's when I think a lot about these digital games, and it's not about the game itself, but how we use, how difficult it is, what type of strategy we're engaging people on, what type of dose, what type of. So I don't know exactly how it works, the restaurant game. Maybe there's some similarities, a multitasking game. But I think here, what we understand is that first there is a journey, right? There is a test that was first validated for assessment purposes and associated with many neuropsych measures. Then you're trying to transform this an intervention tool and have data to support this. So it's not saying, oh, go there, go for a breakfast game and you'll be better, or you prevent dementia. No, it's not about that. It's about how we can use this kind of environment that simulate daily life demands. So it's not about cooking well here, it's about managing demanding situation, and how to learn a tool or strategy and practice this strategy in a way that facilitate the performance. So of course we can only, I think this project I see more about emphasis change and attention control training rather than about the breakfast game itself. I think this is a way to test an approach. So I don't know if an answer, but I think it's very important to keep in mind commercial interest, and when we are dealing in science with digital interventions and tasks, for sure.
Okay, excellent. Well, thank you so much, Sharon. We're going to go ahead and take a break. We'll reconvene at 2:30 for the final Bring It Home session.